So today we have a 59-year-old woman who's kind enough to let us videotape her. What I've done is numb up a couple of little spots, 3 in her abdomen, 1 on each inner thigh, and then 1 on her upper arms, which we'll do later. This is the cannula. I slip it in underneath the skin. It's very gentle. And what I do is whenever I step on the pedal, a little bit of local anesthetic will come out. And if you follow the tubing, you can see the bag has lots of lidocaine. A few words for our audience.
It's not uncomfortable at all.
Great. So she's done well. Some patients do this with straight local. Some patients and most patients, I give them a little Ativan, which is like a Valium. It just makes them a little more relaxed so they're not nervous. And what will happen is I do this for a while. As I said, it's a long, thin tube, but they really barely feel it. And then you'll see in a moment, I'll be substituting this for a fiber optic laser. Now we're on part 2. I have a laser fiber optic, and you can see the little laser beam, or the guidance. The laser's not firing, it's just a guiding light on my hand. And what will happen is as I put it underneath their skin, it's just a gentle motion as I slide back and forth. And what's happening is every time I step on the pedal, the laser's firing and it's melting fat. As I move it closer to the underside of the skin, it will heat up the skin. There's a little temperature probe within the laser itself, and it senses if it's too warm or not warm enough, because I want to heat up the skin, which the patient won't feel at all, and then it'll cause tightening over time, period. As you can see, she's quite comfortable. Say something for the audience so they know I'm not faking
Very
it.
comfortable.
There you go. And the most that'll happen is every once in a while there'll be a little pinch, and I just need to put a little more local. But it should be like this, very easy. It's a very gentle stroking motion, and the laser's firing as I move the fiber optic back and forth. I'll do this for quite some time in her abdomen, then her inner thighs, and then actually her upper arms. And then I'll take that out, and I'll show you the next stage shortly, but I'll suck out the fat. Okay, so we're now on the final stage. This is the liposuction cannula. It's a 3.4. It's quite small. It's made using the same incision, and it just slides in, and it's very gentle. As I go back and forth, that'll be coming out. But as you can see, it's quite painless. It's controlled. Just say that you're comfortable so everybody believes me.
I am comfortable.
There you go. And the most that'll happen, every once in a while there might be a little pinch, but most of the time they'll feel nothing and they'll be comfortable. They know I'm doing something. They'll feel me touching and feel something moving, but it won't hurt. And as you can see, there's fat coming out of the tubing. And this is the final stage. At the very end, they'll put one little suture in, and we'll put a steri strip. They go home right away. They put on a pair of Spanx. They can shower the next day. I want them out walking. They can go back to work. Virtually everybody goes back to work the next day. And I let people resume heavy exercising after 5 days.